Hi, my name is Brooke and I'm a physical therapist assistant working towards my bachelor's in community health so I can then apply to a doctorate program in physical therapy. The main thing that sparked my interest in physical therapy is hippotherapy. For those of you who are unfamiliar with hippotherapy, it is a unique form of therapy where a horse is utilized to optimize patient outcomes. The article I wrote is being published to the Journal of Alternative and Complementary Medicine. The journal focuses on treatment methods with proven effects, however, they are not considered conventional. Examples include yoga, aquatic therapy, acupuncture, and in this case, hippotherapy. The rhetorical conventions I focused on in my article were locos and ecos, comparing and contrasting, cause and effect, and defining. I did so by providing facts and accrediting them, comparing and contrasting hippotherapy with requirements needed for insurance reimbursement, analyzing the effect of hippotherapy on patients, and defining any terms my audience may not be familiar with. Pathos, analogy, and narrating were all rhetorical conventions that were prevalent in the Hippotherapy magazine. However, since I'm writing to an academic journal, I chose to stay away from those conventions and keep my article more fact-based. Not only have I researched the benefits of hippotherapy, but I have had the opportunity to witness and experience them firsthand. Therefore, one thing that has always bothered me is the fact that not all insurance companies will cover hippotherapy. In order to answer the question of why they should cover it, I knew I was going to need to find lots of evidence backing up my argument. Throughout my search, I was easily able to find trials with proven benefits in favor of hippotherapy, a survey stating that 85% of therapists are in fact aware of the benefits, and an article listing the requirements Medicare requires for coverage. Which leads me to my thesis. Hippotherapy costs should be reimbursed by insurance companies due to the fact it has proven benefits, it's provided by a licensed therapist, it achieves results conventional therapy cannot achieve alone, and it meets requirements listed by insurance companies. To summarize, I began my article by first defining what hippotherapy is, a unique form of therapy conducted by licensed professionals in physical, occupational, and speech therapy. I then went into detail about how the rhythmic movement of the horse has many benefits on the rider, such as improved balance, posture, control, range of motion, and strength. In order to give you a better understanding, I attached a short clip. The video demonstrates how the three-dimensional movement of the horse's pelvis directly translates to the rider's pelvis, stimulating the same muscles used during gait. Many people can benefit from hippotherapy, but here are a few commonly seen diagnoses. As you can see, it does not only improve muscular impairments, but also cognitive and psychological impairments. The first article I reviewed was written by Dr. Kim, a medical doctor at Samsung Medical Center's Department of Rehab. The trial analyzed the effects of hippotherapy on gross motor function in patients with cerebral palsy. The trial split the patients into two groups, one receiving aerobic therapy such as biking or walking, and the other group receiving hippotherapy in addition to their conventional therapy. As shown in the graph, the hippotherapy group had better outcomes in gross motor function classification system. Similarly to the last trial, the next trial I reviewed compared the effects of hippotherapy on patients who had a stroke. Again, the patients were divided. One group received hippotherapy for 30 minutes, 3 times a week for 8 weeks, while the other group completed a walking program on a treadmill for the same parameters. As seen in the chart, the hippotherapy group had better outcomes in balance and gait velocity. So if the evidence is there, why don't we see hippotherapy used more often? A survey conducted by the Department of Physical Medicine and Rehabilitation at the University of California answered that very question. The survey was sent out to 40 different rehabilitation centers asking 4 simple questions. 1. Are you familiar with hippotherapy? 2. Do you offer hippotherapy? 3. Why do you believe it is not utilized? And 4. Would you refer a patient to hippotherapy? As you can see, the blue in the top pie chart represents the amount of therapists who are aware of hippotherapy benefits, whereas the blue in the bottom chart are the amount of therapists who actually use it. This next chart explains why so many therapists are hesitant to use it, with the number one reason being lack of insurance. So we now have proven evidence that hippotherapy works, 85% of therapists acknowledging that it works. All we're missing is insurance coverage. The next article I chose to include in my research discusses the importance of documentation in order to get reimbursed from Medicare. Although this article focuses on Medicare and gait training, it can be applied to almost all interventions in most insurance companies. The four listed requirements are as follows. 1. The services are considered under accepted standards of medical practice to be specific and effective treatment for a patient's condition. 2. The services are of such a level of complexity and sophistication, or the condition of the patient is such that the services required can be safely and effectively performed only by a qualified physical therapist or under his or her supervision. 3. There is an expectation that the condition will improve significantly in a reasonable period of time, or the services are necessary to establish a safe, effective maintenance program. And 4. The amount, frequency, and duration of the services are reasonable. Hippotherapy is provided by a licensed therapist who can skillfully adjust each session to the individual patient. Not only has it proven to significantly improve impairments in multiple studies, it has also proven to do so in a significant time frame, therefore meeting all requirements. I hope this presentation has successfully shown you why hippotherapy should be reimbursed by insurance companies and that all patients should have the right to unique, fun therapy with proven benefits. All we can do is continue to educate people about the benefits and advocate for our patients to receive the best possible treatment. Thank you for your time and have a great day.